Being diagnosed with lung cancer if you've never smoked may seem highly unlikely, but according to the CDC, 10 to 20% of cases happen in non-smokers across the U.S. In this week's Health Smart Report, Fox 43's Amy Lutz talked to a woman who was just 37 years old at the time of her diagnosis. She also spoke to a doctor who says getting screened for the disease is more affordable than you'd probably think.
Dr. Troy Moritz with UPMC says 1 in 16 Americans will be diagnosed with lung cancer in their lifetime.
If you can find it early, we know outcomes are so much better. Survival rates go way up.
Despite this, screening rates remain extremely low, with only 8% of eligible people participating.
It's a low-dose CAT scan. It's fairly easy. You're in and out. There's no IV contrast required. So it's not a complicated exam compared to like colonoscopy preps and things like that.
And it's not nearly as costly, with most screening programs running just a couple $100.
Lung cancer does affect, mothers, parents. It affects, young females, young males. It's not just this sort of old smoker's disease.
Parade, a glowing and
Just ask Stephanie Williams, who was 37 years old when she was diagnosed 3 years ago.
I'm not a smoker. I've never been a smoker, and I have no family history of cancer. So this was completely unexpected.
The mother of a kindergartner at the time says she had a mild cough that wouldn't go away.
It would even wax and wane a little bit. I was like, it must be the pollen count in the air that's making me a little scratchy, or maybe it's the humidity today. I would kind of make these excuses.
Her doctor took her concerns seriously, immediately ordering an X-ray. After surgery and chemotherapy, Stephanie is now using her health and experience to be an advocate for others.
Pay attention to your body. If you have a cough that doesn't go away, if you have unintended weight loss or other symptoms you just can't explain, absolutely go get checked out.
She's an advocate. She helps every person she meets that she tells her story to. It helps change the perception of who can get lung cancer.
The American Cancer Society recommends lung cancer screenings for individuals over the age of 50 with a history of smoking a pack a day for 20 years or more. With your Health Smart Report, Amy Lutz, Fox 43 News.